Can synovectomy prevent RA from getting worse over time? Imagine a procedure that can give relief from joint pain and swelling but might not change the overall course of rheumatoid arthritis. That's what synovectomy offers. It's a surgical procedure that involves removing inflamed tissue lining the joints, called the synovium. In rheumatoid arthritis, this lining becomes thickened and inflamed, releasing enzymes that damage cartilage and bone, leading to pain and joint destruction. Removing this tissue can reduce inflammation locally, easing pain and improving joint function temporarily. However, synovectomy does not stop the underlying autoimmune process that causes rheumatoid arthritis to progress throughout the body. It is mainly a way to manage symptoms in specific joints that are stubborn or not responding well to medications. The procedure can be performed using a less invasive method called arthroscopic surgery or through open surgery, depending on the joint and severity. Arthroscopic synovectomy involves small incisions and has a quicker recovery, but it may have a higher chance of the inflammation returning. Open synovectomy is more extensive but can remove more inflamed tissue, though it carries a higher risk of joint stiffness or reduced motion if healing isn't complete. It's important to understand that synovectomy is not a cure. It can provide significant relief for some patients, especially when medications like disease-modifying drugs or steroids aren't enough to control symptoms. It can also slow down cartilage damage in the affected joint for a time. But it does not prevent the disease from affecting other joints or stop the systemic autoimmune activity that causes joint damage throughout the body. Studies show that synovectomy does not significantly alter the long-term progression of rheumatoid arthritis or prevent joint deterioration over time. Recurrence of joint inflammation is common, and the disease may continue to worsen despite surgery. In some cases, synovectomy is performed during joint replacement surgeries, such as knee replacements. Research indicates that removing inflamed synovium during these procedures does not improve pain or joint motion and might even increase some risks. It's generally not recommended solely for that purpose. Overall, synovectomy is best seen as a tool for symptom relief in carefully selected patients. It can help reduce pain and slow local joint damage temporarily but is not a substitute for ongoing medical treatments like disease-modifying drugs or biologic therapies. These systemic treatments are essential to controlling the overall disease activity and preventing further joint damage. Always consult with a healthcare professional to determine the best approach for your specific situation, as individual responses can vary. Remember, managing rheumatoid arthritis involves a combination of medical therapies and sometimes surgical options, but the goal is always to control the disease and maintain quality of life.